This is Dr. Mohan Rao, Professor of Medicine from Chettinad Hospital and Research Institute. Today I am going to discuss about an important topic for day-to-day life. It's nothing but sleep. So I am not going to talk on sleep, but I am going to talk on the sleep disorders. So as you all know, sleep is the elemental phenomenon of life and also indispensable phase of human existence. So without sleep, so if you don't have sleep, I think we'll land up with so many issues pertaining not only to your mental and physical, but also it can cause an impact over the occupational also. So the occupational challenges will come down. So as we all know, the sleep duration varies. So from the beginning of your life, that is in infancy, the infant usually sleeps up to 20 hours. That is 16 to 20 hours is the sleep duration for an infant. As age advances, in the childhood period, the child sleeps for nearly 10 to 12 hours. And at the age of nearly 10 years, so the child goes for 9 to 10 hours of sleep. And we all know the adult will sleep up to, say, on an average, only 7 to 8 hours. But once the age is getting advanced, that is late age, on an average, the adult sleeps only for 6.5 hours. So sleep, actually there is no sleep center. There is no sleep center in our system, but it is said to be generated from the medullary reticular formation. So medullary reticular formation, thalamus, even the basal forebrain. From there, the sleep is generated. Okay, so without adequate sleep, I said it causes some hazard over the physical, mental, as well the occupational aspect. So what happens? When you have a deprivation of sleep? You all know it is an essential component, highly essential component, which facilitates the body restitution. So it is more important for body restitution and also the coordination of your facilitation of your motor activities. And importantly, not only apart from the motor activities, it is also said to consolidate your learning and memory skills. So that's why it is considered to be more important. Suppose if you have deprivation, so deprivation of sleep, say for 200 hours, so there is one literature says if the individual lacks sleep for more than 200 hours, so it causes various damages. So it can cause a change in the personality. So because the patient tend to be irritable. So irritability, lack of concentration, incoordination, and even the sleeplessness, increased sleepless night, and importantly, the patient goes for developing tremors also. The patient goes for tremors, even the nystagmus, the to and jerky movement of the eye, it so happens. As days goes on, the microsleep will result in so many aspects. It causes various errors in human life, and importantly, the individual is more prone to face the accidents, including the driving and other things. What I mean to say that if the lorry drivers and so on who have got the sleepless nights and drive the vehicle, so they commit more of accidents. And very importantly, the patient goes for abnormal behaviors like your illusions and also hallucinations. So the hallucinations, which is nothing but your false sense perception, occurs more with the tactile and the visual. So visual and tactile hallucinations are much more common with these type of sleep disorders. So sleep disorders, today we are going to talk on the two or three important aspects. One is insomnia, which is nothing but sleeplessness. And the increased tendency to go for sleeplessness is otherwise known as narcolepsy. And importantly, the restless leg syndrome. So restless leg syndrome occurs more commonly due to the nutritional deficit, especially your chronic anemia. So all these things we are going to discuss today. So I just want to give a brief introduction about the sleep and the other aspects. I think you would have read about the sleep issues. You have got two types of sleeps. One is rapid eye movement sleep and non-rapid eye opening, that is REM and NREM. Things will be responsible for the sleep attitudes. So with regard to this, the insights. So today's insights, we want to discuss about the various aspects. First, we should understand. So what is more important is the basic clinical understanding of the definitions for each entity, like what I said in the beginning, your insomnia, your even your narcolepsy and restless leg syndrome. So next thing, we will have to discuss about the prevalence, that is epidemiology of these various entities, and importantly the basic pathophysiology. In the clinical medicine, if you don't understand the pathology or pathophysiology, it is not apt to get along with the clinical features and other aspects. So once you understand that basic pathophysiology, the abnormal functioning, and then you need to identify the factors which have got high predilection to go for these sleep disorders, and ultimately the various presentation, so the various clinical presentation, and also you need to make a differential diagnosis. In the field of medicine, you always make a differential diagnosis apart from your provisional diagnosis, and we need to formulate the insights with regard to the apt management. So having understood about the clinical presentation, the discussion part, the various modalities should be projected to have the proper diagnosis. Without proper diagnosis, no appropriate treatment will be initiated. So that's more important, and we need to discuss something with regard to the various case scenarios pertaining to world population also. So this slide actually explains. So what are the sleep disorders, which in the beginning itself I said the sleep disorders will certainly cause an impact over the not only the physical, mental, but also over the occupational health. So that's more important, no? So this will cause high morbidity and mortality that occurs globally, because once it is there, so there is an enormous pressure over the economic status, not only on the individual part, the economic status of the individual or the family. So the burden goes for the entire society also. So the global burden of economic hardships can come. Other than that, so these things, the prevalence. So what is the prevalence of these entities? It is very commonly seen in the elderly patients. So the sleep deprivation or disorders are more commonly seen in the elderly individuals, and also so much so even in the women's sector. And importantly, the other aspects like the medical and psychiatric illnesses, the illnesses, the chronic comorbid illnesses pertaining to medicine, they got an impact over the occurrence of the sleep disorders and may pose some complications also. That in turn complicates the process. And the effective treatment has to be planned in order to provide a better quality of life to the individual. And always the management of sleep disorders will involve the multidisciplinary personals. So that is important. The multidisciplinary action or the approach is very much essential to tackle this issue. And what do you mean by insomnia? So the insomnia, as I said beginning, so it is only the sleeplessness. So the sleeplessness indicates that the patient finds it very difficult to sleep and experiences the non-restorating sleep. Okay, because the patient will have ample time. In spite of adequate time, the patient will not have any sleep. So that is more important. When do you say insomnia? Especially when the patient has got sleeplessness for more than 3 nights per week, and when that is persisting for 3 months together, you call it as insomnia. So other than that, the daytime impairment, the daytime impairment following the sleeplessness is another important clinical aspect or the diagnostic criteria for insomnia, because this has got a definite impact over the functional ability of the individual. And importantly, these disorders, you need to exclude certain disorders prior to your diagnosis of your insomnia, because the other disorders, especially the psychiatric illnesses or substance abuse, all can make some issues. So we may be confused at one point of time. So for that matter, you need to differentiate each one before branding that the patient has got some insomnia. And importantly, the relevance pertaining to clinical aspect will be based on the certain classification and a certain presentation. So the comorbid illnesses, especially the chronic illnesses like your malignancy and so on, should be ruled out in order to improve the patient's outcome. So these are all the important aspects that we need to explore. And importantly, when you consider about the incidence and prevalence, as I said in the beginning, it is more prevalent among women and elderly individuals. It is said around 20% of the global population are affected with this disorder that is called insomnia. And importantly, the various comorbidities pertaining especially to the cardiovascular and other metabolic, especially the diabetes mellitus, have got a direct impact over this insomnia. And importantly, this particular deficit, this particular form of sleep disorder is more commonly seen among the shift workers. So especially the software engineers and all other, even the medical and other paramedical individuals who work on shift basis, they are more prone to be affected with this particular aspect. And importantly, it causes a challenge, it causes enormous pressure over the economic aspect because because it is going to cause some repeated visits to the hospital, and taking the drugs for a longer period will cause some economic hardships also, because you will have to focus. So the targeted therapy is more important in the aspect of insomnia. And other than that, we need to understand the correlation. We need to understand the correlation between the biology and also the behavioral aspect of the individual, because these things are multifactorial. As I said in the beginning, it is a multifactorial issue. So it has got a definite interaction between the biological aspects and also the behavioral aspects, and so much so the psychological aspects. So what are the important the neurobiological? One is GABA. So GABA aminobutyric acid, and also the hypothalamic pituitary adrenal axis play a very important role apart from the sympathetic activity. So these are all very important. So the lower GABA, it leads on to the weakness that weakens the inhibitions, and it will worsen the insomnia. And the axis, especially the hypothalamic adrenal axis, definitely interrupts the sleep pattern, and it causes hyperarousal also. The hyperarousal is nothing but the periodical wakefulness also. So how about the sympathetic activity? So sympathetic activity has got more predilection to cause some inflammatory changes. So these inflammatory responses can result in the alteration or disruption of the sleep pattern. So here the behavioral disorders, so definitely promotes the insomnia, and the more important is only the stress, the day-to-day stress, and the habits. The poor habits has got a definite role apart from the other aspects of the individual. So you will have to identify. So you will have to identify the high risk group. So what are the risk factors or high risk factors which predisposes for this particular sleep disorder? First and foremost, I said the stress. The psychological stress plays an important role apart from the disorders, psychological disorder like your dementia, depression, and so on, even the anxiety, and the metabolic disorders, chronic illnesses like your diabetes, even the heart failure, cardiometabolic. More important is your heart failure and coronary artery disease. So they play an important role, and it causes a definite impact over the insomnia. And importantly, the poor hygiene. So the poor hygiene in the sense, so lack of adapting. The individual has to practice the adaptation of sleep. That is very important. The sleep hygiene is very much important to avoid this insomnia. And importantly, the other substance abuse, especially the patients who are more addicted to certain drugs and other smoke and other things. So they have the poor quality of sleep also. And importantly, the shift workers. So shift workers, especially the software engineers, the medical and paramedical individuals, will have a change in the circadian rhythm. So that's very important, because sleep actually reflects the 24 hours circadian rhythm only. And importantly, when the patient has got some difficulty in initiating and also maintaining the sleep, that also plays an important role and causes the risk factor for insomnia. And the daytime impairment. So following your sleeplessness, your daytime activity is going to be impaired. That is quite natural. So the impairment in day-to-day life or daytime activities will pose an impact over the insomnia. And what are the assessment? So how to assess for this insomnia to make an appropriate diagnosis? The list is enlisted for really 6. Number 1 is the diary. So importance goes for the diary, and the index, the sleeplessness severity index, you will have to make it out. So the diary usually will have the information with regard to the sleep and wakeful times, especially for the 2 weeks, to continuous 2 weeks data should be entered into the diary. So next is the insomnia. The insomnia severity index ought to be endorsed, which is an important tool. So the 7-item tool is very, very important. Apart from there is one more called Epworth. So Epworth scale is another important tool to make an entry with regard to the daytime sleepiness. And the mental health. So the mental health screening ought to be done with the two important things. What is given in the slide is that GAT-7 and PHQ-9. And importantly, the labs. So the lab support should come. Where does it come? The decreased metabolism as occurs in a thyroid disease. You will have to evaluate the thyroid stimulating hormone, TSH. And also importantly, the iron. Iron is an essential trace element, so the deficit will definitely cause an impact, especially over the restless leg syndrome, what is going to be discussed now. And importantly, the other important parameter is only the PSG. PSG is nothing but the polysomnography. The polysomnography usually helps to evaluate the sleep apneas as occurs in the obstructive sleep apnea and so on. So these are all the important tools that you need to keep it in your mind, before before approaching a case of insomnia. So what are the things that ought to be ruled out? I told in the beginning, prior to make a diagnosis, you need to make a differential diagnosis. So these things, I said, the OSA plays a very important role. Obstructive sleep apnea is another important, and restless leg syndrome that I said, it is mainly caused due to the nutritional deficit, that to the trace element of your iron. And you need to eliminate the mood disorders, especially the anxiety disorders. So anxiety disorders and the chronic depressive disorders, you need to rule out. And other than that, the circadian rhythm has to be assessed and evaluated in order to differentiate insomnia also. And more importantly, the medication history. The medication, and so much so the substance abuse, you need to go for a detailed history. The history pertaining to these important aspects should be taken into consideration. So in order to have a better clinical approach to this insomnia. So other than that, you may not have a proper planning of a treatment pertaining to this particular disorder. And how to implement. So everything is evidence-based nowadays. So there is no escape, you will have to have an evidence-based medicine, and it can have both pharmacological and non-pharmacological also. So what are the non-pharmacological aspects of management? So there are certain things, the cognitive-based test, that CBTA is nothing but your cognitive based. So this is important to have this sleep restriction. So this will have the stimulus, So this will have a stimulus control, and also it will restrict the sleep. So much so it is highly useful for relaxation also. So better before your sleep, it will have some relaxation also. The stimulus. So what is important? The stimulus is your bedroom. Your bed itself should make some stimulus. When you enter into in your room, the sleeping room or bedroom, so you should have a drive. Once you see your bed, you should have a drive to go for a sleep. So that is the stimulus. Your bed itself is a stimulation, and importantly, you will have to avoid some restrictions. So the time for actual the sleep time should have some restrictions. You will have to have some sleep efficiency. In order to promote the sleep efficiency, you will have to limit your timing. So restrict yourself, confine to your bed, and go to the bed also. And importantly, the cognition plays an important role, because the cognition usually can have a negative issue, it can have a modification over the negative sleep also, and which usually helps to bring down the anxiety and other related issues. And importantly, you need to have some relaxations. So the relaxations, the progressive muscular relaxation is very, very important. Before going to sleep, you need to have some relaxation techniques. The stretching exercise, all other things will help to have and induce, not only the induced sleep, you will have a deep sleep also. And the sleep hygiene is very, very, very important, because you will have to have a schedule. So the proper schedule you should make, and you will have to have a proper stimulant, and you will have to optimize. So you will have to optimize the environment. So in order to have a better sleep. So all those things are important in the aspect with regard to the non-pharmacological aspect. So how about the drug therapy? The pharmacotherapy and drug therapy, they have some merits and demerits also. But it is definitely indicated, it is definitely indicated to overcome this issue. And first and foremost, you will have to submit the patient for behavioral therapy. The cognitive aspect should be improved. Cognitive aspects are nothing but your intelligent memory and other aspects. So try to overcome the insomnia by adopting more of behavioral therapy. That is more important. Other than that, the hypnotics. So the hypnotics are more commonly employed in the management of your insomnia, especially the drugs like your zolpidem. So the zolpidem, zolpidem and melatonin receptor agonist. Very, very important drug is melatonin. And SZO and other one is esopiclozone, and all are important because the doxepin usually is started with a low dose. Then this dose is stepped up based on the requirement. And other drugs, other off-label agents also to be used, like your amitriptyline. So amitriptyline is not only the anti-epileptic, that is also very much judiciously used in the management of insomnia, and other antipsychotics and antihistamines also is very much useful. And you will have to have the intention to have a better consideration, because most of the drugs will cause some ill effects. Most of the drugs. So you will have to be very, very careful to avoid certain important clinical aspects. The drug should not impair the cognitive ability, important, and should not have any amnesias, selective loss of memory sometimes. And importantly, there should be no rebound insomnia. There should be no insomnia, and rebound insomnia should be very much reduced. And there are fall of risk, especially in the elderly patients, when they are on these antipsychotic drugs or the sedatives. Usually they tend to have falls, frequent falls, with which when they sustain some head injuries, it is life-threatening. So you need to be very, very cautious and judicial in the dosage and use of drugs also. You will have to have a periodical monitoring and reviews. So periodic reviews are very much important. You will have to actually assess the adverse effects and also promote the prescription. The de-prescription also important. You cannot keep on escalating the drug. At one point of time, when there is a better improvement or recovery, so the drug also should be reduced. So the reduction or enhancement, everything will be done based on the periodic monitoring. That's more important. And how to have an optimization. So what do you mean by optimized insomnia management? Because that contains the priority. The priority is given to the safety first. So especially in elderly individuals. So you will have to optimize the treatment in certain cadres, especially elderly patients. You will have to have a close monitoring, and the comorbid illness. So major comorbid illness like your post-myocardial infarction, heart failures, the metabolic derangement like your diabetes, all those things will have some close monitoring. And importantly, you will have to have some integration. So the drug should provide better mental health, that's very, very important. So you will have to combat the comorbid illness, especially pertaining to your psychiatric disorders. And you will have to have some strategies in order to bring up certain behavioral changes, especially for the shift workers. You will have to adopt certain modalities or strategies to bring down the behavioral upsets and other untoward effects. So those are all important. So what are the prognosis? So what are the outcome and the risk factors? The outcome you need to assess, especially when the patient is suffering chronically. So because it is going to cause some impact also. The chronic insomnias will definitely cause some issues over the heart. So it can result in the development of high blood pressures, and it can result in the ischemic changes in the heart. And so much so, the metabolic derangement is also another issue, and which carries high mortality and morbidity also. And importantly, these mental issues. So the mental issue is totally paralyzed, especially the triggering of your anxiety disorder or depression can also be a part of your your treatment. So that you need to be ready to tackle also. You need to provide, your ultimate aim is to provide a good quality of life to the individual. And importantly, once the sleeplessness is taken off, the patient will, apart from getting the good quality of life, he can have a better occupational circumstances, the ambience, because he can be alert. So as I said in the beginning, so the sleeplessness is going to cause some irritability and lack of concentration also. With that, there will be a reduction in the performance. So the individual performance is reduced pertaining to his job. So the occupational accidents also avoided. As I said in the beginning, especially in patients with driving profession. So when the micro sleep is a problem, they are more prone for accidents, more prone to commit accidents. So those things can be lowered, by introducing some proper medication. And you will have to have some concern over the socio-economic status. So I said the long-term issue, the long-term sleeplessness is going to cause a burden over the economic stand, not only to the family, for the entire zone or the entire society also. So it's always important. So early diagnosis and early intervention will definitely bring about excellent results. That definitely improves the outcome also. So because your role is not only bring down the issue, the problem should be minimized and the patient should be taken off from the risk factors also. So how to manage? So it is a multifactorial approach. So the persistent sleep disorder is going to be presented with the easy fatigability, irritability, and the daytime fatigability is more common, and the patients without any pre-existing disease. So this daytime tiredness or weakness or fatigability will be there without any pre-existing psychiatric illnesses also. And importantly, the diagnostic tool, especially the PSG polysomnography, usually helps to evaluate, especially patients with the sleep apneas. So obstructive sleep apneas is very common with patients with obesity. So that is an important tool to have the workup. And you need to advocate. So the early pharmacological treatment, and importantly, the cognitive behavior or the behavioral therapy should be instituted little early. You will have to implement, in order to have better outcome. And importantly, the efficiency, the treatment to have a better sleep efficiency should be planned. And more importantly, the daytime functioning. Daytime functioning is more important for every individual. So all those things, so these things should be deprivated, and it is a combined treatment modalities. You need to adopt a combined treatment modalities. And this particular slide, so narcolepsy is a condition where the patient goes for a frequent spells of your sleeplessness. So here another term is called the cataplexy. So cataplexy is one. So due to the heightened activity, sometimes when the patient goes for a change, so when he goes for a severe cry or laughter, they go for sudden fatigability or sudden distress. So the sudden emotional change can result in some distress or fatigability, but the patient will not lose his level of consciousness. So those things are important. Narcolepsy is a very chronic disease. So very chronic diseases, and which causes more of a daytime sleepiness. So more daytime sleepiness is otherwise known as narcolepsy, and the cataplexy is usually the muscle loss. So the patient goes for a severe or drastic reduction in the muscle loss, which can have two types. So the cataplexy and a low hypopectin. So a low hypocretin is the first type, and the normal hypocretin is the another level, that is called type 2 also. So these can cause some sleep paralysis or the false sense perception or your hallucinations. So these are all the important things which interact. So this is a cyclical representation given in the pictorial presentation. And what is the epidemiology? What is the percentage of involvement of patients with narcolepsy? So it's more important. It is up to 0.05%. The global census says it is 0.025 to 0.05 percentage overall, and it causes some overlap syndrome. So So it is more commonly or abundantly seen in the adolescent people. You would have seen the college students. They simply they sleep for hours together. Even the daytime sleep is very common. So those are very common, up to 0.05% globally, and it is present up to the adult life. So that is early adult life. And these two important the neurons, the autoimmune destruction. Usually the hypothalamic neurons, they produce this both hypocretin and also the orexin. So these essential neuropeptides, will actually they are responsible for the regulation of this wakefulness. So the wakefulness is made only with these two, the hypocretin and the orexin, which are nothing but the neuropeptides. So those things, because once it is prevented, so naturally the daytime sleepiness is more. And more importantly, like every other disease, it has got a genetic predisposition. Even the sleep disorder like your narcolepsy has got more of a genetic predisposition. So especially the DOP1 and HLA-DOP1 is the gene that is responsible for this occurrence of this narcolepsy. And so much so it causes some change in the immune regulation also. And more importantly, what are the triggers? So environmental source is more important. No? The environmental triggers we need to identify. It is very noteworthy to note that even a simple viral infections, especially with your influenza, and sometimes following a vaccination. I think many are vaccinated for H1N1 also. So the swine flu vaccine, so following this vaccination, following the exposure to viral infection, this can actually this can cause an impact over the autoimmune responses. With that, so it leads on to narcolepsy also. The patient goes for narcolepsy following these two incidents, that is exposure to vaccination following a viral exposure. And the implications pertain to therapeutics. So usually the development of the immunomodulatory therapies. So you need to formulate immunomodulatory therapies, especially by preserving this neuropeptides, especially your hypocretin and other things, in order to bring back the wakefulness. You will have to restore the wakefulness by preserving this the neuropeptides. More important. And what are the hallmark? So the hallmark is given clearly, the daytime sleepiness, that what we discussed in the beginning. So the patient goes for the monotonous activities. So the daytime sleep and also the sudden muscle tone loss. The loss of sudden muscle tone happens especially in the weakness on both sides. It is more common or one of the predominant features of your narcolepsy. And importantly, the sleep paralysis. Sleep paralysis happen in the sleep-wakeful transient period. And importantly, the other important aspect is that the visual and sensory experiences are more commonly seen in patients with narcolepsy also. So here, awakening and other complications occur pertaining to this issue. And importantly, the other signs. So the other signs which are nothing but the breaks in the night sleep, the fragmented nocturnal sleep, and the automatic behavior are all said to be associated with this narcolepsy. These are all the hallmarks. So these hallmarks you need to keep it in your mind for better assessment of your this narcolepsy as sleep disorder. And how to streamline. So because having understood about the clinical picture, you need to streamline to make an appropriate diagnosis. So the appropriate diagnosis will help us to submit the patient for the appropriate diagnostic tools or diagnosis also. So first, you need to make a better history. You need to make a diagnosis based on the clinical history, based on the symptoms, based on the presentation, based on the sleep paralysis and other cataplexy and so on. And the polysomnography plays an important role in the evaluation of your sleep apneas, the obstructive sleep apneas, and importantly the latency test. So the multiple sleep latency, that is MSLT, multiple sleep latency test is one which is supported by less than 8 minutes, the latency, and also that score, SOREMPS will confirm the narcolepsy. And when the diagnosis is little obscure, so when it is not very much clear, so you will have to take some CSF also. The CSF, in which the neuropeptides are evaluated. The hypocretin measurement from the CSF is another important diagnostic, but it is not done as a routine, but only in doubtful cases who lacks a definite diagnosis of this narcolepsy. And what are the DDs or the differential diagnosis? So you need to consider, definitely you need to consider OSA, that is obstructive sleep apnea. Apart from that, the idiopathic hypersomnia without any rapid eye movement changes also should be ruled out, and you need to have a differentiation. Definitely the psychiatric illnesses like your depression should be ruled out prior to your diagnosis of your narcolepsy. And importantly, the patients on other substance abuse. So the substance abuse like your the other drugs of addiction or the other smokes, marijuana and other smokes. So you need to differentiate that substance abuse. And importantly, the seizure disorders, because many at times will be confused with the narcolepsy because the patient will be in the post-ictal confusions. So in that way you need to consider to rule out any seizure disorders, and also the comprehensive evaluation is more important. You need to adopt only the comprehensive evaluation so that everything will be streamlined. So the multidisciplinary approach will be appropriate only when you make an attempt in a methodical mode. And how to have an integration. How to integrate this behavioral therapy and also the pharmacological therapy. So importantly, the behavioral interventions, because the sleep-wake schedule, so the structured sleep-wakeful schedule you should make, and it should be endorsed in the diary, what we said in the beginning. And definitely you need to provide some psychological support. Apart from that, there is a role for pharmacological drugs also. The first line goes because the ormamental, the modafinil and both are drugs of choice in the daytime sleep. And importantly, other useful drugs are your pitolisant, which targets the histamine receptors. And other antidepressants, so other antidepressants like your venlafaxine and fluoxetine will definitely bring about the cataplexy and also the rapid eye movement related symptoms. So these are all the important drugs in the management of your narcolepsy. And having understood something about the narcolepsy, so we need to evaluate the prognosis. So what is the prognosis, or what is the long-term benefit or the long-term issues with regard to this narcolepsy? Because it is going to be there for lifetime. It's a lifelong issue, and patients are going to be presented with the recurrent symptoms of your daytime sleepiness and cataplexy, but you need to have an evaluation. So the evaluation should be made under the risk factors. So the risk factors pertaining to your psychiatric illnesses will definitely be the target. And other than that, the social and other influences, the social and occupational challenges should have been focused, in order to, because there should not be any impairment in the work performance. The ultimate goal is to avoid the impairment pertaining to your work performance. And the patient should have better interaction. The social interaction should be highly influenced, and also we need to provide a better quality of life also. So for every other disease, it is always to introduce the preventive aspect like your early diagnosis and treatment definitely prevents the disability also. So timely identification. So based on the presentation, you should make a timely diagnosis, and also you need to adopt the functional, the daily functional and overall improvement. The daily quality of life should be improved. That should be a target. And the several researches are ongoing, especially with the neuropeptides. So the neuropeptide based therapy is being in flow. So it is in the pipeline to bring about more information and more research work towards this neuropeptide therapy. And the management aspect of your type 1, So it is done based on this is a clinical scenario, isn't it? The young man, the 18-year-old man with the daytime sleepiness, cataplexy, and also the vivid hallucinations. So those are all the symptoms. So diagnosis is made based on the MSSLT scoring, and also the behavioral aspect also is endorsed based on the sleep hygiene and so on. The effective treatment is initiated with this modafinil, which actually helps to reduce the sleepiness, and this venlafaxine will help to lower the cataplexy. So these are all the important. What is the outcome? So this the outcome is the patient will have a marked reduction. So marked reduction in the sleeplessness. So he will improve. So once at the age of 18, if the sleeplessness is reduced much more, so you will have better performance. So the academic performance is better, and he is going to adopt with the society also. So what is the insight? So the cataplexy usually confirmed for narcolepsy type 1. The combined treatment, combined therapy will produce some better results. And what is restless leg syndrome? I said it is mainly due to the trace element, the iron. So when there is a deficit in the iron, definitely the patient will have, it is an abnormal movement, the abnormal lower limb movement with or without paresthesia. So it is a sort of a sensory motor neurological dysfunction or disorder. Usually the patient tend to move his legs accompanied by the uncomfortable sensation, that is the tingling sensation sometimes, paresthesia also present sometimes. And at times the patient may complain of pain over the limbs also, and usually that will be relieved. So these symptoms will be relieved, or sometimes it will get worsen also. So when the patient is inactive, the symptoms are not much appreciated. Sometimes the rest also will induce more of pain also. And the height symptoms, so sometimes during the late evening, the symptoms will be little higher also. That is also very common, which causes a direct or indirect impact over the sleep. So this restless leg syndrome usually causes a considerable impact over the sleep. And importantly, the diagnosis is made mainly on the clinical evaluation. So and the iron profile. So we do the iron studies. So especially your hemoglobin, MCV, your serum transferrin saturation, ferritin, even TABC, all are iron profile. Now all those things should be taken into consideration prior to this therapy. And the epidemiology. So what are the incidents? So the epidemiology, it's more in pregnant women. So elderly individuals, pregnant women will have more of this. And because in pregnancy, the anemia complicating pregnancy is an important issue. And the chronic ailment, even the CKD patients. So the cause for anemia in CKD is only the defective erythropoietin, isn't it? So those things will prevail. And another important is the dopaminergic effect. So when there is a reduction in the D2 receptors, so in the basal ganglia, definitely it is going to cause some impairment over the dopamine signaling. So that also leads to the development of this particular disorder, restless leg syndrome. The iron deficit, so the iron deficit, especially the CNS iron, so which causes some disruption to the dopamine synthesis, leading on to this restless leg syndrome. So in this context, more importantly, the ferritin. So the ferritin level less than 75 nanograms is a common presentation, very common presentation in restless leg syndrome. And as I said in the beginning, every other disease will have a genetic predisposition. So even in restless leg syndrome, the gene, so the gene like MEIS1 and also BTBD9, these two genes are said to be associated with the occurrence of your restless leg syndrome. And the features, what are the features that will make us to suspect or make a diagnosis of restless? The sensory component. So the patient is going to complain of the tingling sensation. Sometimes they'll say some insect is crawling on my limb. So the crawling sensation or the tingling sensation, sometimes the burning sensation over the feet, all will make us to suspect about the sensory disturbances in a patient with suspected restless leg syndrome. And importantly, the timing. So the symptoms usually begin in the resting stage, and it may worsen during the late evening and many times during night, which causes an impact over the sleep. What is more important is, so it temporarily relieved. It temporarily relieved with certain movements also. Another important thing is the impact on the sleep. So because the patient the patient will have a difficulty in going for sleep is another important thing, and usually the daytime fatigueness following the sleeplessness is very common in a restless syndrome. And importantly, 80% of the patients, the periodic limb movement in sleep and the involuntary limb movement. So all those things will be evaluated with your PSG. That is nothing but your polysomnography when the diagnosis is not very clear or obscure. And the history as usual. So the detailed history is very, very important to evaluate this. And the IRLS, that is nothing but your international scaling rate, that helps to evaluate this restless leg syndrome. And you need to have a support from the labs also. What I said in the beginning, the iron profile. So the iron profile is important. Not only ferritin, transferrin saturation, MCV, sometimes reticulocyte count, all are important in the evaluation of this. And other than this polysomnography plays an important role in the evaluation or diagnosis of this particular disorder. What are the DDs? As usual, we need to differentiate all the things, the cramps that caused due to other conditions, the cramps caused due to other neuropathies should be ruled out, and the positional pain also should be ruled out, from the venous insufficiency. Sometimes you get pain due to venous stasis. So the DAC sometimes, and importantly the other medications, the other medications like your antipsychotics. So that may also precipitate certain pain over the limbs. Patient tends to go for sleep apnea sometimes. So especially in condition like your obstructive sleep apnea as occurs in obesity, and these things will worsen the symptoms also. And the chronic kidney disease, wherein the erythropoietin defect can cause anemia. So this is another important thing, not only in CKD but also end-stage renal disease and patients with chronic mental illnesses. So they may have an impact over the quality of life, mimicking your restless leg syndrome. How about the cardiovascular? Yes, definitely the cardiovascular risk or the diseases will have to be ruled out in order to have a better focus on the this particular restless leg syndrome also. So all other disease, the history taking and proper investigations are very, very important to rule out this restless leg syndrome. So what is the basic strategies? So what are the strategies that are important? You will have to rule out the underlying causes. So always consider the underlying causes. Importantly, the ferritin level below 75 nanogram is very important, and you just check with the medication also whether the patient has discontinued the medication, such as the SSRIs, serotonin reuptake inhibitors, and also the other antihistamines, which can sometimes exacerbate the restless leg syndrome also. So non-pharmacological. So what are the non-pharmacological? Because you will have to have a stretching exercise. So prior to your retirement to the bed, you will have to do some rest with the stretching exercise, and also the cold baths. Use hot and cold baths for better vasodilation, and the compressions, the pneumatic compressions also are highly useful, in order to have a better sleep hygiene and also improve the symptoms. And importantly, the drug management. So the common drugs what we use to treat this neurological disorder, especially the gabapentin, the pregabalin is a recent one, given in the dose of 75 milligram BD or OD or gabapentin will definitely elevate the pain, and it will minimize the tingling sensation and other neurological issues. And the other dopaminergic agents like your pramipexole and this ropinirole all will have a better effect over the control of your restless leg syndrome. And the carbamazepine, very good old drug. These things will cause some additional benefit over the treatment of your restless leg syndrome. So how about the modulatory therapy? So the neuromodulation can come from the other drugs, which which causes an effect over the peroneal nerve stimulation, and also the spinal cord stimulation therapy. All plays an important or major role in the treatment of your restless leg syndrome. So the management on special occasions, or the focusing on special population, especially during pregnancy. Pregnancy is an important aspect in your human life, So here you need to have some concern over the fetus, because the iron supplementation should be such that the patient doesn't go for, because anemia complicating pregnancy, the patient goes for even heart failure many at times. So you need to have a modification over the lifestyle. So apart from your dietary, you'll have to introduce some first line drugs, especially for restless leg syndrome and the CKD patients. CKD patient will have anemia due to defective erythropoietin. You need to you need to tailor the drug dosing and other things, and importantly, patient on other psychiatric illnesses, especially your depressions and insomnia. So here you need to take care of the quantity and quality of the drug also, and the other things to recognize the prognosis. So especially when the symptoms are remitting, that periodic remitting, so that needs to be that needs some adjustment with regard to the drug dosage also. And as I said earlier, so early diagnosis and treatment will definitely prevent the disability. So for better living or better day-to-day function, the early diagnosis should always be adopted, and the multidisciplinary approach. That's very important. It's not as a single mode of treatment, it is only the multidisciplinary, a team of personnel to be treated for you to treat these complex diseases. And what are the other things that we need to check with the challenges, the clinical challenges, what we face is the newer modalities. So the improvement can come with the stellate ganglion blocker injectors, especially in CKD patients. Introduction of the stellate ganglion blocker usually will have a better improvement or the recovery for the refractory, because in spite of all other therapy, sometimes that they can go for a refractory state. So for that matter, the stellate ganglion blockers are so much employed, and the behavioral management it's more important, especially in younger individuals. The behavioral therapy is more important non-pharmacological approach. And the case studies have been happened for these three important sleep disorders, like your insomnia, narcolepsy, and also the restless syndrome. So this algorithm, this is an algorithm to make a better diagnosis and better approach. So first you should make a clinical presentation, better understanding of your clinical presentation and the challenges pertaining to your diagnosis. And the other one is you will have to analyze, there should be a critical analysis. So critical analysis should be focused based on the evidence. So and another important thing, you will have to identify the genetic factors. You will have to identify not only genetic but also the environmental and other comorbid factors. So you need to adopt the case insights. You need to adopt the case insights for betterment of the individual care and promote the diagnostic approach. The acumen or the diagnostic acumen should be enhanced, and importantly, you need to follow the current guidelines and other innovative therapies. Other innovative therapy like spinal cord stimulation should also be considered, and always adopt the multidisciplinary approach for the complex cases, and also the awareness. You need to create an awareness, increase the awareness, especially, and focus over the research. So more of research has to be carried out in order to bring down this ailment. So what are the pediatric insomnias, the chronic insomnia? Because even the child will have this insomnia at the age of 13 also. The most common cause nowadays is only the electronic gadgets. So the electronic gadgets like your mobile phone, so when it is used for more than 2 hours, when the mobile phones are used more than 2 hours in the late night, especially after 9 p.m., that causes a definite impact over the insomnia, especially among pediatric age group. And importantly, the night lamp, the blue lights, so usually they delays the melatonin secretion. So melatonin secretion is more during the night time. So because once the day comes, the sunlight will trigger the retina, and the melatonin returns back. So the blue light usually inhibits or delays the secretion of the melatonin. That needs to be considered, that reduces the sleep duration. when there is a melatonin deficit, so because the sleep deprivation comes, so you need to take care of that blue light also. So how to improve the emotional aspects? So the emotional aspects and the cognitive aspect should be improved with the better media content, Other than that, the behavioral therapy, what was said in the beginning, so you need to screen the habits. So the sleep habits ought to be screened, emphasize more on the behavioral assessment. The pediatric children should be closely monitored because all these things are modifiable. So you need to take care of all these issues and periodically screen. So the periodical screening is very, very important to improve the sleep outcome. So these are all very important aspects. And what are the behavioral interventions? Because the smartphone phone, you will have to restrict. So the restriction of smartphone is very, very essential, that too after the period. So after 9 p.m., this child should not open up the phone. And education pertaining to the sleep hygiene is very, very important, and the monitoring is more important. The sleep outcome monitoring is to be especially closely monitored within 2 weeks, what I said in the beginning. And the benefits, these benefits will be actually will improve only after 16 weeks. So the periodic monitoring, periodic assessment comes after 16 weeks only. So with long-term efficacy and safety. And the involvement of family, it's always important, So involvement and so the family support will help to help to overcome the behavioral changes also. So there should be an integrated aspect. The integrated clinical evaluation is very, very important pertaining to this treatment, and it will help to have a better intervention also. So what are the diagnostic and treatment? So the adult issues, adult insomnia that occurs chronically. So you need to identify the clinical features based on the history, and the sleep diaries are to be monitored, and the multi-component cognitive behavioral therapy is important. So tailoring the pharmacotherapies and also the integration of the sleep hygiene. So see, all are important. All these things will definitely play a role and important aspects with regard to the management of this particular entity. So for narcolepsy, so this is more seen after the pandemic. So especially following the COVID infections, so many of the patients, most of the youngsters, they went in for the daytime sleepiness. So this has got an impact. So this got an impact over the issue, the burning issue, So much studies are going on, to confirm the diagnosis of narcolepsy, especially in post-COVID patients. And the autoimmune, that neurological polypeptide, that hypocretin, usually the damage will be evaluated, and you will have to be very watchful. So focus the vigilant screening for the clinical aspect in the post-pandemic. So all the poor patients who suffered with this COVID-19 should be periodically screened, and the proper diagnosis and proper management has to be advocated. And how to optimize. So these are all the standard therapies, for optimizing the stimulants. So use of these stimulants, especially the modafinil and methylphenidate, usually will counteract the excessive sleeplessness. And sodium oxybate. Another important drug is a sodium oxybate, which actually reduce the cataplexy. So reduce the cataplexy and improve the symptoms overall. And the early diagnosis is always important for the detection as well the initiation of therapy. And importantly, the treatment is individualized. So you need to formulate a plan according to the individual. So not as a general one. So the individualized treatment is always important, and in order to assess, in order to read the potential side effects also. So you will have to curtail the need also. And importantly, the narcolepsy care, more to be focused on the post-COVID patients, because these patients are more prone for the sleep disorders, and the periodical monitoring, periodic evaluation is more important. You always have a close monitoring and safe use of the drugs. The drugs should be selected very safely to avoid all the ill effects or side effects. So the genetic links. So with regard to restless leg syndrome, the genetic links also should be evaluated. So the familial restless leg syndromes with the genetic mutations should be evaluated, and the pathogenesis pertaining to hereditary component should also be evaluated, and the dopaminergic symptomatic treatment. Always focus on the symptomatic treatment for this dopaminergic effect, and also the lifestyle modification. The patient needs to have lifestyle modification, adequate iron supplementation to be there, and incorporate the family history and the clinical assessment and evaluation. More important. And what are the stellate ganglion blockers? So because this is very, very useful for the patients who are refractory to this routine treatment in restless leg syndrome. The importance goes for the focusing much on the nephrotic syndrome. Much to be focused on the nephrotic syndrome, and marked symptoms will improve in the due course, validating the block's potential efficacy, and importantly the interventions. So the administration of stellate ganglion as a cutting edge, so in the therapeutic option, and also the other clinical significance, so which will highlight more on the stellate ganglion blockers. So that usually emphasizes the necessity for multidisciplinary approach. So I think this we have come to the end, and the MCQs will be shared to the students. So here ends our topic, an important topic in day-to-day practice in human life. The sleep is a more essential component of your day-to-day activity. The deprivation causes so much impact on the physical, mental, as well the occupational health. So very, very important. See that we refresh with the subject periodically, and much more research is important in the outcome of this disease. Thank you so much.